The resurgence of measles in the United States has raised alarm among public health experts, who warn that declining vaccination rates could lead to a full-scale public health crisis. Since the beginning of the year, more than 130 cases have been reported in Texas and New Mexico alone, including the tragic death of an unvaccinated child. Infectious disease specialists, including renowned pediatrician Dr. Paul Offit, see this as a warning sign of a worsening situation. Despite these concerns, the new U.S. Health Secretary, Robert F. Kennedy Jr., has downplayed the threat, arguing that measles outbreaks occur every year and do not represent an unusual trend. The reality, however, is far more concerning. Before the introduction of vaccines, measles was a devastating disease, leading to severe complications such as pneumonia, encephalitis, and death, particularly among children. Through widespread vaccination, measles had been virtually eradicated in the U.S. But in recent years, vaccine hesitancy, fueled by misinformation, distrust in health authorities, and the politicization of medical science, has led to declining immunization rates. The COVID-19 pandemic only worsened the situation, as skepticism about public health recommendations grew, creating an environment where preventable diseases are now making a dangerous comeback. Kennedy himself has contributed to this growing distrust. Over the years, he has promoted unfounded claims linking childhood vaccines to autism, a theory thoroughly debunked by decades of scientific research. He has also referred to COVID-19 vaccines as the deadliest vaccines ever made, a statement that contradicts overwhelming evidence supporting their safety and effectiveness. His leadership raises serious concerns about the future of public health policy in the U.S., particularly when it comes to vaccine-preventable diseases. Experts warn that without immediate intervention, measles outbreaks will become more frequent and severe. The disease is one of the most contagious viruses known, spreading through airborne transmission and capable of infecting 90% of unvaccinated individuals exposed to it. Unlike many other infectious diseases, there is no specific treatment for measles. Prevention through vaccination is the only effective strategy. Public health officials stress that restoring confidence in vaccines is critical. They urge parents to follow official immunization schedules and for government agencies to launch more aggressive public education campaigns. Schools and child care facilities must also enforce vaccination requirements to prevent further outbreaks. If action is not taken swiftly, the consequences could extend beyond measles, leading to the return of other once-controlled diseases such as mumps, rubella, and whooping cough. The current trend is a dangerous reversal of decades of medical progress. What was once a preventable and nearly eliminated disease is now resurging due to misinformation and declining public trust. The responsibility now falls on policymakers, healthcare professionals, and society as a whole to counteract this growing crisis. Without stronger efforts to increase vaccination rates, the U.S. risks an era where preventable childhood deaths become tragically common once again.